is Jessica Cruz, and I will be presenting my research paper on telemedicine and older adults. Telemedicine encompasses a range of activities used to deliver care at a distance without direct physical contact with the patient. A study by the Pew Research Center showed that only 38% of older adults feel confident using digital tools to manage their health. In my paper, I aim to address the following research questions. 1. What are the digital and technological challenges that older adults face when using technology? 2. How do issues of usability and accessibility affect that quality and equity of telemedicine for older adult patients? And 3. What technological interventions can improve telemedicine adoption among older adults? So, what are the digital and technological challenges older adults face using telemedicine? I specifically targeted 2 areas. 1, age-related impairments, and 2, digital literacy. The 2 age-related impairments I specifically talk about are 1, visual impairments, which a study by Dr. Colleen in 2021 showed that 1 in 4 adults over the age of 71 in the U.S. have some sort of visual impairment. Also, I talked about auditory impairments, which the National Institute of Deafness and Other Communication Disorders reported in 2024 that around 22% of older adults between 65 and 74 have disabled hearing loss. And that number jumps to 55% when we're talking about older adults over the age of 75. These impairments directly correlate with how older adults interact with technology. Gaps in digital literacy. The American Library Association describes digital literacy as knowing digital tools and using them in communicative and collaborative ways. A study by the Pew Research Center in 2021 found that 54% of older adults between 65 and 74 and 68% of adults over 75 feel not at all or only a little comfortable using computers, smartphones, or any electronic device. That's a pretty big number. Many older patients feel overwhelmed about the amount of information they feel they need to learn, or that they're just too advanced in age to understand technology. If the older adults are unable to use the devices that connect them remotely to their medical providers, then telemedicine is not going to be a good option to ensure the equitable and quality health care that they need. Next, I want to talk about the issues of usability and accessibility and how they affect that quality and equity of telemedicine. So, talking about accessibility in particular, one of the most important things that we're talking about is internet access. You can't have telemedicine without internet. The Pew Research Center in 2021 showed that 82% of adults between 65 and 69 had internet access at home, but that number drops to 44% when you're talking about adults over the age of 70. A study by the Older Adults and Technology Services Incorporated found in 2021 that roughly 22 million Americans 65 and older still did not have broadband access. Other than internet access, you're also important to talk about the accessibility of digital tools. The Pew Research Center also found in 2024 that 24% of older adults over the age of 65 still did not even own a smartphone. So that's almost a quarter of older adults that still don't own a smartphone. So I'm sure when we're talking about a number that big, you have to talk about the issues of accessibility there. Next, we're going to talk about the issues of usability. And one of the most important of those issues when we're talking about telemedicine is video access, video visits. So video access can arguably be the most important aspect of telemedicine appointments, yet it's one that most significant thing that older adults struggle with. A study conducted by Dr. Bahati in 2022 showed that 27% of participants in their study who were originally scheduled for video visits had to convert to a phone-only visit because of the technological difficulties they had with accessing video. The other issue of usability is the platform itself. Issues for elderly patients in telemedicine, you have to talk about the digital platform to access that appointment. And a survey conducted by Dr. Mayo in 2022 showed that 24% of older adults did not even know how to connect with the telemedicine platform itself. So again, you're talking about a quarter of older adults who couldn't even just log onto the platform to conduct the visit. That same survey showed that 82% of homebound older adults required assistance from a caregiver to complete their telemedicine visit or to participate in it. So what are possible technological interventions that could help create an equitable and quality care through telemedicine for our older adults? The first thing I talk about is that telemedicine digital platforms should compensate for the visual and auditory impairments. They need to provide bright, high-contrast screen displays for those with vision impairments, and they need to make sure that the sound frequency and volume are appropriate levels for those with hearing issues. I think creating a central telemedicine platform with like a standardized process could, and it could even include getting vitals, filling out forms, scheduling. I think that could really help older adults access telemedicine better. Healthcare providers could provide telemedicine workshops for their older adult patients when they're in-house for a visit. And last, but like really the most important that I feel would be including older adults in the design and testing of future telemedicine platforms, getting their feedback early on in the early stages of creating it so that we know what works and what really doesn't. In conclusion, studies have shown that a large portion of older adults are satisfied with telemedicine and they prefer to have it as an option for continued care from their providers. If the technological usability and accessibility challenges could be tackled, telemedicine could provide older adults with quality and equitable health care. Including older adults in the design process of these platforms would help address a lot of the technological and usability issues that affect telemedicine today. Future research, I think some of the things that they could really focus on would be, number one, how can we increase digital literacy for older adults? Two, focus on the quality of care of telemedicine versus in-person care. And three, how can we increase quality of care through telemedicine? If we address the technological issues, what can be done to create better care for our older adults? The three lessons that I took away from this class, number one, is the misconception of the elderly and technology. I was so surprised that if we can help them overcome their visual and auditory limitations with technology, they are so much more likely to use it. Two, I learned that there are a lot of digital devices and applications that can help older adults live more independently. And three, I can help many of our older constituents at the library that lack digital literacy by offering programs to seniors who need help learning how to use and feel comfortable with digital tools and platforms. Thank you so much for your time. Thanks.